Hello, I'm Dr. Beam. I'm here today to give you an inside view of what it would be like for your pet to have acupuncture. Now, many of you have probably had acupuncture yourselves, including massage or chiropractics, but what would it be like for your pet to have acupuncture? I'd like to show you how Reno, this is my friend Reno, how she responds to her treatment. She just came in and you can see she's pretty alert. Your dog may not be this calm, but she is pretty alert. And we're going to show how acupuncture can help her. She suffers from hip dysplasia, and she does have some soreness across her back and her neck and her legs as well. Acupuncture, as you might not know, has been around for thousands of years. And we know that acupuncture can help restore the balance of blood flow and energy through the body. Acupuncture uses lines or meridians that run along the entire body. These lines have been well mapped out, and first in humans, and then have been transposed onto animals. It has been known for thousands of years that these lines, or maps of these lines, exist over the entire body. Along these lines, the acupuncture points exist, and we know scientifically that when stimulated, below there are neurovascular bundles that release chemicals to help blood flow, and that in turn helps to oxygenate the tissues. Some of these chemicals are endorphins and enkephalins. They're natural painkillers for the body. And so with Reno, we'd like to give an example of how she will feel better with this treatment and allow this area all along her back and her neck and her legs where there's soreness in the muscles and joints. These areas represent areas of stagnation of blood and energy flow, or qi. And we'd like to show you how it might feel for your pet to have acupuncture. And as I said, some of the pets maybe won't be as quiet and calm as Reno, but you will be amazed to see that she will relax and be able to enjoy her treatment. So I'd like to start first by putting some needles. We're actually going to put some needles around her head and her neck just to get the blood flowing and get her to start feeling better. And then we may go ahead and progress to some Tuina, which is some Chinese massage and chiropractics, just to help relax her a little bit more, get her muscles relaxed. And then we may finish again with some additional acupuncture across her back and her back legs. She has several areas along this pathway along her back and her back legs, as well as her front legs and her neck, because she has to overuse these in order to compensate for her hip dysplasia. So Miss Reno, we're going to go ahead and start putting some needles in here. And these are small, soft, flexible needles, and Reno tolerates them pretty well. And you might say, my dog would never sit still, or my cat would never sit still for someone to put needles in their head or in their body. But they're pretty well tolerated. As you can see, Reno doesn't mind too much. And every patient's different, so we just tailor their techniques or whatever they might need for each patient. Some of my patients are like to run around the room, and if that's what they want to do, then we let them do that. And we just put a needle in, take a break, come back. We might do some massage first, and that's going to help a lot just to relax them. Okay, now I'm going to do some massage on her. We're going to do a little bit of massage and just a little stretching, just to see if we can get her muscles loosened up a little bit. When we go across her back, we find that there's a lot of areas through the middle part of her back that are sore. I'm just going to loosen these up a little bit. We'll try to see her reaction to that as well. See what you think about the descriptions that her face has given you. And Reno's mom does do some of this at home, and that's one thing we can do, is teach you how to do this at home. Some of these techniques anyway, you know, not all of it, but maybe one or two 3 exercises you can do at home to be a part of this whole therapy and whole process of healing. Most of the time, you know, the dogs, the cats, the patients are very accepting with this at home, and in their own natural relaxed environment they can really benefit from this. And as well, at being like on a daily basis, which is much better than just coming to see me, you know, once a week or once a month. And this, of course, would be either before acupuncture or, you know, in conjunction with acupuncture. I usually do finish with acupuncture because it's going to be a little bit stronger, maybe last the patients longer as far as after they leave the hospital. Good girl. Good pup. Those hitting these points that are specifically for pain. We call them the aspirin point, bladder 60 back here. And we're going to get some other areas down here on her foot as well. And hopefully she'll be done here in a few minutes. It's been about 30 minutes now. We started with some acupuncture around Reno's head and neck, and then we did some massage along her body and her legs. She was able to relax and lay down on her side, and able to get some of the front legs worked on as well. And her mouth is open, she looks comfortable, her eyes are kind of softened. She's still alert, she's still looking for her mama, who should be here shortly. But I think you can tell by the looks on her face and also through the video that she yawned a couple of times. That's a very kind of relaxing thing. Her nose is dripping. I don't think you can see that on the camera, but it's a little bit of water coming from her nose. She's just very relaxed, feels good. And here in a few minutes after these needles, we put these additional needles in, they'll sit in for another 10 minutes and then she'll be ready to go. Okay, we're done with her acupuncture now. We're going to take these needles out. I'm just going to finish with a little light massaging, and we will probably show her owner how to do a couple of these massage techniques at home, just in between her sessions so that she can stay comfortable. Maybe. So probably one of them you may not be able to see really well from there, but it was the one that I did across her back here. We're actually just pulling up the skin and walking our fingers up her back. This is very invigorating to the tissues, the skin, and the deeper muscles. I'm pressing with my thumb a little bit into her muscles. And of course, we wouldn't just start with that right away. We'd probably start with some of the lighter techniques, just a few seconds or a few minutes of the lighter techniques, rubbing and massaging, and then go with this. And so she'll probably go home with that for homework to do at home, and maybe some work on the back legs here as well. And there's one thing that really helps to stimulate some of the acupuncture points around the knee, which are very good for her condition. And it's just hands on the inside and the outside of the knee, and shaking back and forth, rubbing vigorously, and her muscles just kind of rotate around her bone, and that feels really good. Look at her face. That feels good. Okay.